Welcome to Don't Be Rash, the Pediatric Dermatology Show, the owner's manual for your kid's skin, and the official podcast for the Society for Pediatric Dermatology. I'm your host, Dr. K, board certified dermatologist, board certified pediatric dermatologist as well, and a father of two minions. On today's episode, we're going to unpack the science around what makes newborn baby skin so unique. We'll discuss the do's and don'ts of newborn baby skincare. We'll discuss the preferred way to clean the dirty diaper area, and perhaps most importantly, will help you navigate the baby product aisle so that parents can sort of dodge the marketing noise that surrounds us whenever we're in one of those marketplaces. Joining me today on this journey is my colleague and friend, Dr. Raegan Hunt, Director of Pediatric Dermatology at Texas Children's Hospital. Welcome, Dr. Hunt.
Hi, thank you for having me.
Thank you for joining. Now, I've known you for a long while, but the audience may not know what got you interested in the first place in newborn baby skin as a clinical focus. How did you get interested in that?
Yeah, I think it's just well, first, the babies are cute, so there's that. But more importantly, there's a lot of physiologic change, dynamic change that happens in newborn skin, and we have characteristic rashes. And then we also have challenges, like, for example, in preterm infants, when they're born with a very, very thin skin barrier, then there are serious considerations that need to be taken into account. And we're learning a lot about the microbiome and how that functions with our skin as well, and how it's established in infants. So I think a lot of interesting questions to look at.
Now, that's pretty nuanced clinical specialty, and glad that you were doing it because I don't think there are a lot of people who have that focus. Um, why don't you walk us through your approach to what makes a newborn baby's skin so special, so unique?
Yeah, well, so when babies are born, they go from a wet environment to a dry environment, and their skin has to transition. And as it's transitioning, it's going to a new pH in the new environment, and that establishes the acid mantle. And the
Mm.
acid mantle is really helpful in skin function to help us defend against pathogens and also to keep the skin functional layers good. So babies have some increase in the loss of water through their skin, the transepidermal water loss, and their skin continues to mature and develop over the whole first year of life.
And what's protecting them biologically when they're born from losing all that moisture even more so? What's that sort of cheese that we see all over newborn babies?
Yes, yes, that special cheese is nature's moisturizer, I suppose. It's corneocytes and lipids that sort of adhere, and it's called the Vernix Caseosa. And we and experts recommend leaving the Vernix Caseosa, if possible, on the infant because that helps protect the maturing skin barrier in the early day to days of life.
And just in general, I mean, I think my kind of go-to guess would be that newborn baby skin is much, much thinner than, say, a mid-childhood patient or an adult. But what level of thinness are we talking about? Is it enough that it's significant in terms of affecting how much water gets lost through that skin barrier?
Um, so in preterm babies, it's very, very thin, and then it definitely is going to be fragile and lose a lot of water, which can affect their, circulatory balance in terms of the volume that they're working with, and they can become dehydrated easily, and it's very, very fragile. But term infants generally have pretty close to the same thickness, but they don't necessarily have the fully established organization of the lipid structures that sort of comes with time and maturation and the adjustments of the pH.
And taken all into consideration in aggregate, this is why we have jobs, right?
Yes. And of course,
So,
yeah, of course, the microbiome part is fascinating too. So
yeah.
when babies are born, then they establish commensal organisms and microbiome biological organisms that live with us on our skin surface in balance and harmony. And that is established a lot has to do with from the mother, donating that microbiome as it transitions. But there's multiple factors at play. And so it's magical.
And when you're saying it's shared by the mom, you're saying as the baby's sort of transvaginal is picking up some of those commensal bacteria. How does that work for C-section babies?
I think they get with the skin to skin contact with breastfeeding and care and bonding, then it goes that way.
So it's not that a baby born C-section is missing out on all the wonderful things. It's really that skin to skin that we push as pediatricians and as pediatric dermatologists that probably makes the point.
Yes.
Awesome. So let's ignore the preemies for now, but you have a full term baby that's born, and you are young parents. You've never had any children before. You don't have anyone who's already had a couple kids that can give you some wisdom and pass down all those family clinical pearls. You're left alone by yourself. Literally, if you had an owner's manual, you'd be reading it, but you don't. So, what's your approach to having that family care for this newborn baby who's just been sort of thrust into their laps?
Yeah. So you mean in terms of just general skincare, right?
Yeah, yeah. I don't want. Let's not get into anything outside of our specialty. Geez, we could have enough of a discussion.
Yeah, so I mean, an early question might be what to do about the umbilical cord.
Yeah.
It's attached for a while and then it will slough. So generally, historically people used to clean with alcohol and do some specific things, but actually not necessary, and just leave it to dry out and separate. And bathing in general. Probably every day to every other day, but probably not multiple times a day because that can be overly drying. So bathing
Mhm.
like every day to every other day with a gentle cleanser. When we say cleanser, we don't want a true soap, like those are harsher on the lipids in the epidermis and can actually disrupt the skin barrier. So we want a
Mhm.
gentle cleanser with a neutral pH. Um, and and then we just want to bathe, every day to every other day, kind of focusing on the dirty areas. You could do spot cleaning in between if things come up. And then immediately after, patting the baby dry, and then using a good bland skin emollient, like a moisturizer.
Okay. That's all a good start. Let me dive in a little bit more around the cord care. Typically, when would you expect to see that cord naturally come off and sort of be quote unquote normal?
I think usually about 2 weeks or
Mhm.
so.
Okay.
Yeah.
And if you have a baby where that cord is persisting, or what are some other specific warning signs that you might look for as a parent that maybe something isn't quite right, that you might want to get a little bit further investigated?
Oh yeah, so well, it's reasonably common to get a little growth in umbilical cord granuloma as it separates, like some fleshy tissue that's just kind of an over response. Simplification would be kind of like overhealing, um,
Mhm.
and so that's something that may look moist, and the pediatrician should check that. They can usually do a small treatment in the office to help with that and help promote the healing. Um, Things to be aware of that are rare. I suppose if there is leakage of urine through the area, there could be like a developmental connection that from early fetal life between the urinary tract and the skin through that area.
Mhm.
And similarly, you can have a connection to the GI tract in rare cases, and even fecal content can come through. And those would be things that you would definitely want to bring to the pediatrician's attention early so that they can get your child to the best specialist.
Any fluid leakage whatsoever after about 2 weeks should be looked at further. Is that fair to say?
That's fair. Yes.
Now, diving into the bathtub, you said once a day or once every other day. Are we using cool water, lukewarm water? What's your approach there?
Lukewarm water is best. The babies are a little temperature sensitive, so we don't want them in really cold water because they might get too cold.
Mhm.
And hot water obviously would risk burning. So probably lukewarm would be the best suggestion.
And what are you looking for in terms of a specific cleanser that you mentioned?
Yeah, specific cleanser. So looking for something that's actually labeled fragrance free. Okay, because there's another term that's very confusing. I'm sure you know the unscented. So
Oh
unscented
yeah.
doesn't mean doesn't have fragrance. Technically, it just means it has fragrances that offset each other, making it net neutral. And then so it still has chemical irritants that can really bother the skin. So looking for one that says that it's fragrance free. But I don't think it's necessarily important to look for one that's labeled for baby.
I agree. I absolutely agree. The idea that the baby is supposed to smell like lavender, though, is the point there. That's probably not what we're going for at this point.
Right, right. We want to probably minimize those potentially irritating things, including some of the natural organic essences that can be
Oh yeah.
irritating as well. Yeah.
Yeah, botanical extracts, essential oils, those can be highly sensitizing. We don't love those. How about some of the preservatives that we typically might find in adult products? We're trying to avoid them as well, I assume.
Yeah, so preservatives can be a sensitizer too for contact allergens. And they're in a lot of products. So I think good to avoid them. A good go-to that makes it a little easy to think about is just petroleum jelly. So just the original petroleum jelly or Vaseline. It's been available for more than 150 years, and it is a very useful and very, very gentle topical emollient that can help the skin barrier function.
Yeah, I feel like that's a nice protectant as well as a sealant, so it sort of locks in that moisture and keeps the baby from losing it to the atmosphere. I don't feel like it adds directly too much moisture to the skin. I don't know. Do you have a feeling about that one way or the other?
No, I agree with you. I think it's more like helps trap the water inside, but doesn't necessarily add to it. So in a very dry skin situation, it may not be as helpful. Mhm.
Yeah, we know from the new pediatric atopic dermatitis guidelines that we covered in a previous show, the recommendations for atopic derm at least was we don't care what moisturizer so much as you're using a moisturizer. Is that the same, would you say, for newborns or are you looking, lotion, moisturizing cream? You mentioned Vaseline, petrolatum as one of your go-tos. Does it need to have ceramides? Does it need to have other specific ingredients, or is it more that you're just using something and using it consistently?
Yeah, I think that there is not enough research in the area, but I think the most important thing is what you pointed out is that you're using it consistently, and I think avoiding a lot of added, fragrances or other ingredients. So ceramides I think are nice. In theory, it definitely helps the support the lipid layers in the skin that help build that barrier. So certainly if somebody has a skin issue where they're struggling, that might be a really good thing to try adding. But unfortunately, there's not a lot of clear data. So we usually are recommending Vaseline or, a good blend, a little bit thicker cream, usually better than like a more liquid lotion.
Yeah, the lotions are a little too runny for me. I tell my patients usually if you can pump it, that's probably not what we're going for. But there's some good ones out there that could still probably get the job done. But I think I'm with you in terms of trying to get something a little thicker on there that acts both as a protectant as well as a moisturizer or a humectant. So
Yeah, and
um,
sometimes with I think young babies when if they do get rashes, let's say they um, are developing atopic dermatitis, it may be uncomfortable to use creams sometimes because if the skin is like really rough and sort of scratched open, then an ointment base like Vaseline again might be a little more soothing, might not sting as much.
because of less preservatives, presumably, right, or whatever else might be in the cream formulation.
Hmm.
Mhm. Fair. Um, How about a problem that's ubiquitous, literally, to every infant, newborn diaper care? What are you recommending? How should a parent, we're not talking about irritant contact diaper dermatitis right now. We're just talking about normal care. A kid is wearing a diaper, poops and pees into that bucket that's holding the poop and pee up against the skin. What are you recommending parents do to keep that area clean, but also to maintain that barrier so that it's intact and not turning into an irritant diaper dermatitis?
Yeah, it's so easy, I think, to get those irritant diaper dermatitis because it's constant exposure to irritation, right?
Yeah.
But I think it really is recommended to use like the super absorbent current diapers. And diaper rashes are a lot less common than they used to be, like since we have that. Um, I know there are environmental considerations and some people prefer cloth diapering, but cloth diapering is much harder in terms of protecting the skin barrier function. So because the technology in these diapers is pretty amazing. It just like sucks all that in and separates it from the skin surface. But definitely recommend using a barrier cream of some sort. So usually a zinc oxide barrier cream and reapplying that with each diaper change. So we're trying to get ahead of it. Like we're trying to give the skin some reinforcement so that it can withstand this constant assault from the urine and the stool. And of course, we want to change the diapers as quickly as we can.
Hmm.
And then after we clean, if we're cleaning, we want to use like a water on a cloth, like a soft cloth with water, or we want to use a wipe if we need to. It's real life, it's convenient.
Yep.
Ones for sure that are fragrance free. Yeah, so they do make wipes that have a lot of scent and other things that can be irritating.
Avoid those.
Yeah, we want to avoid those and then put that layer on of the barrier cream. Vaseline can work as well again, but zinc oxide is sort of a great go-to.
In terms of wipes, do you recommend like a water-based, non-fragrance? Is that what I'm hearing?
Yes, definitely recommend like a water-based, non-fragrant
Yeah.
uh, baby wipe.
Yeah. We can there's real life and then there's the textbook, and real life is people are using these things. So we better be aware of that and be able to recommend some good products out there because like you said, it's a matter of convenience, and patients and their families certainly are using these products, and maybe we wouldn't want them to in a conference setting where we're lecturing on an ideal, but that's not what's happening in real life. Just like I have to admit, I was a staunch environmentalist until we had our first baby. And then like you mentioned with the diapers, hey, sorry, this is what we need to do. Now I'm back to staunch environmentalism. So do as I say, not as I do. How about that? So,
Yes, yes. And diapers are funny things too to think about. Like there have been some times where the cute little decorations on the diapers have been found to cause a little localized rash underneath them, like so an allergic contact dermatitis to the
yeah, the
blue ink.
plastic in them
Yeah,
too.
or the plastic on the edges, or the little blue color, including like Cookie Monster, like you can get a rash under the Cookie Monster, but not Elmo.
Sort
No.
of sort of funny that Cookie Monster caused the problem. Sounds like the Grouch should have done that, but I don't know. Maybe that was my attempt at a Sesame Street joke. Probably get in trouble for that one, but fair enough. So, Dr. Hunt, let's say you're a new family, you've got your newborn baby sitting in your lap, you're looking down for the first time, going, "Geez, I wish I just remembered what Dr. Hunt had told me from that podcast." What's the one message that you would want to convey to a new family in terms of taking care of their newborn baby's skin?
I would want to convey that really less is more, and that we want to just keep it simple. Keep it simple for the delicate baby skin.
Well, there you go. Thanks for tuning in to this episode of Don't Be Rash, Pediatric Dermatology Show, official podcast of the Society for Pediatric Dermatology. I'm your host, Dr. Andrew Krakowski. Please don't forget to subscribe to our show on your favorite podcast platform and check out don'tberash.org for more information. A special thank you to our nonprofit sponsor, the Society for Pediatric Dermatology, for making this episode possible. Please make sure to check out pedsderm.net to find a pediatric dermatologist near you and to access all of the amazing science-supported fact-based resources that the organization offers its members and the public at large. Until next time, remember, keep calm and don't be rash.